Hello, I'm Dr. Deepak Rao, consultant laparoscopic surgeon at the Motherhood Group of Hospitals, Bangalore. A diagnostic hysteroscopy is a procedure where a thin telescope attached to a camera is inserted through the vagina, through the cervix, which is the mouth of the uterus, into the cavity of the uterus to examine the cavity of the uterus to look for abnormalities. The most common indication for a diagnostic hysteroscopy is abnormal uterine bleeding. It could be heavy uterine bleeding, prolonged uterine bleeding, intermenstrual uterine bleeding. And another less common indication for a diagnostic hysteroscopy is scanty uterine bleeding or having periods which have less flow than normal. There are 4 or 5 common findings that we get when we do a diagnostic hysteroscopy. Most of the time, the diagnostic hysteroscopy is required because these lesions or diseases are not picked up on routine ultrasounds. The first and probably the most common finding that we get are what are called endometrial polyps. Polyps are grape-like growths which are attached to the wall of the uterus and can cause heavy menstrual bleeding, intermenstrual bleeding, as well as continuous spotting. These polyps can be cancerous or malignant, but most of the time, endometrial polyps in the younger age of patients is not cancerous and not malignant. Polyps, if found, will be treated at the same sitting by excising them with scissors. The second common finding are submucosal fibroids. Small submucosal fibroids may be detected on scans or may be missed on scans. While fibroids normally might grow fairly large without symptoms, submucosal fibroids are not the same. Submucosal fibroids, even if they are very small, can cause severe symptoms. Again, if we find a submucous fibroid on a diagnostic hysteroscopy, we convert the procedure to an operative hysteroscopy and we do a submucous fibroid resection. A resection is done with a special type of a hysteroscopic instrument called a resectoscope. The resectoscope has a tip which carries current and the fibroid can be shaved millimeter by millimeter away from the uterus. The third type of finding we often have in a diagnostic hysteroscopy is a uterine septum. A uterine septum is a curtain which separates the uterus into a left and a right hemiuterus. These septums are often also not picked up on scans and can cause both infertility as well as recurrent miscarriages or abortions. Again, if we find a septum, we can easily excise the septum with scissors at the same sitting. The fourth, reasonably rare finding is uterine cancers or malignancies. These are most often in the older age group of patients, and a hysteroscopy helps diagnose the location of the cancer, the extent of the cancer, and also helps us to take a biopsy from the worst area of the lesions so that we can know how advanced the cancer is. Another less common finding in hysteroscopy is adhesions or what is called Asherman syndrome. In a patient who has scanty periods, we might find that the cavity of the uterus is obliterated by what are called intrauterine adhesions or synechiae. These close the endometrial cavity or the uterine cavity, and therefore the surface area available for menstrual bleeding is less, and the patients often have scanty periods. So, how is a hysteroscopy performed? We normally perform a hysteroscopy under general anesthesia. The patient comes in the morning on an empty stomach. The procedure is performed in the morning, and the patients usually go home 3 to 4 hours after the procedure. They can return to complete normal activity by the next day, and they do not need to take either bed rest or leave from work. Another question that patients often ask is about the risks of a hysteroscopy. A hysteroscopy done by an experienced surgeon is almost complication-free. It's a fairly minor procedure. There is no cutting, there is no stitching. The pain is almost absent, and patients go home the same day. It is truly a procedure which has revolutionized the treatment for patients with abnormal uterine bleeding in modern gynecology. Thank you.